Hello, everybody. I'm doing the first preamble because we don't currently have a chair for this committee, but the first order of business will be to elect a chair for this meeting. Firstly, I'd just like to say good afternoon and welcome you to this special meeting of the People Overview and Scrutiny Committee. And I'd like to inform those present that this meeting is being webcast live and will be capable of repeated viewing. Okay. Neither the chair nor the deputy chair of People Overview and Scrutiny Committee are in attendance today. In that situation, committee procedure rules state that in the absence of the chair or deputy chair at a meeting of a committee or subcommittee, those voting members present, which means the councillor members, shall elect a person from amongst their number to preside over the meeting. I therefore need to ask if any member wishes to nominate themselves as chair for this meeting only. Councillor Sheard, are you nominating yourself? Yes. Does any other member wish to nominate themselves for this privilege? No. So is the committee content that Councillor Sheard chairs for this meeting only? Thank you. So I'll now pass over to Councillor Sheard to chair.
Thank you, Pat Giles. Right, thank you everyone. Before we get going, we've got to get on with can you please go through the procedural business? Does anyone here need to declare themselves as a substitute today? Councillor Azaduzzaman.
Yes, thank you, Chair. I'm subbing for Councillor Gog.
Thank you, Councillor Hill.
Yeah, Councillor Hill subbing for Councillor McLean.
Thank you. Are there any declarations of interest in relation to items included on the agenda that members wish to raise? No, that's absolutely fine. In that case, exclusion of press and public, we have no Part 2 items on the agenda today, so the press and public will not be excluded. In that case, I will turn to Chair's comms. Today, we are here at this special meeting to scrutinise the 2026-27 budget ahead of the budget going to the full council on the 26th of February. We are joined by Councillor Jacob Taylor, Deputy Leader of the Council and Cabinet Member for Finance and City Regeneration, as well as John Hooton, Interim Director of Property and Finance, who will be talking to us about the budget and then taking questions from members. We are also joined by Cabinet members and officers who are on hand to help with any questions specific to their service areas. They will not be presenting to us as they did at the previous budget scrutiny meeting. However, following the recommendation of the previous budget meeting, I've asked there be a short presentation specifically on the public health budget to help inform members' discussion. Public health will also be considered as an item for a future scheduled committee meeting, so we can examine how this spend is being realised throughout the council operation. In relation to amendments from the committee, can I ask if you have any amendments, if you can propose them as we discuss that item in questioning? This is so we know which item you are referring to when noting it down, and we can have that item fresh in our minds as we discuss it. We will then read out each of these amendments at the end of the meeting and vote them as normal. Also, to make sure we get through all the cabinet members in a reasonable time, I will be asking for questioning of each cabinet member to not last more than roughly half an hour. I have tried to put those cabinet members who we wouldn't need to spend as much time on up first, so we can spend more time focusing on those with larger briefs. But please bear in mind not to take up too much time from other members of the committee. I will look to hold a 10-minute break as appropriate, a point roughly halfway through the meeting. With that, I hand over to Councillor Jacob Taylor. Thank you.
Thank you, Chair, and congratulations on your election to that post. So I'll try and be very brief because, as in previous meetings, we want to get straight to the questions and scrutiny. So I'll give a very high-level overview of where we are with the budget position. Back in December, we came to this committee, and obviously at that point we had published a draft budget. At that point, we noted a budget gap of 25 million, which is obviously driven by the pressures that the council are subject to, particularly in areas of demand services and care budgets. And we noted that we had published a draft budget that did not completely close the gap, and that we would have to come back with a full published draft budget in the new year, which is what we have now done, and that's obviously what we're scrutinising today. The pressures that we talked about obviously are homelessness and temporary accommodation being the largest single pressure, but also some pressures on demand and cost for adult social care and children's placements, and then also an issue with housing benefit subsidy. We got our final local government settlement as a statement post the last draft budget, and then now subsequently in the last week our actual final cash settlement. It hasn't moved a huge amount versus what we had understood and what we had forecast, and so therefore the gap remained roughly the same. We've now, as I say, published a draft budget that sets a balanced budget for the next year, including some additional proposals that I know we will talk about today and that have been set out in the report. We've also set out in the report that we are requesting additional financial support from the government, specifically in relation to temporary accommodation and emergency accommodation. I just want to spend a little bit of time on that, which is to give the context to committee that in last year's budget, or indeed the budget that we're now operating under for this financial year, we set a budget amount for emergency accommodation, temporary accommodation, homelessness of £8 million in the net general fund. And I want to be clear that that is the net amount to the council. So obviously where we have families in temporary and emergency accommodation, we do receive housing benefit, and so that covers some of the cost, and where it's in-house, it covers more all of the cost. But where the amount that we have to pay for emergency accommodation is more than that, it then becomes a net cost to the council, and that's where it comes into the net general fund. So as I say, we set a budget of £8 million for this financial year. What we're forecasting that to go to, and that's not guesstimates, it's based on actual demand and cost at the moment, is £20 million next year. So that's a big increase, more than doubling of the cost of that pressure. And of course, that is not to absolutely blame families, quite the opposite. It's to blame the system, really. And so what we're doing in our overall approach to this budget is to say that we have to fix that underlying issue. And we really do, because that £20 million that we're forecast as a pressure, every penny of that £20 million is going out the door to private landlords. And that is such a failure of our overall housing system and a failure of the underlying structure of the economy, really, because we should not be paying that amount of money, of taxpayers' money, to private landlords to cover up the underlying failures of the housing market. One, we shouldn't have that level of families facing homelessness and temporary accommodation, and then two, we shouldn't be providing it in such an expensive way by transferring taxpayers' money to a private landlord. So what we're doing and what our approach is, and we covered this previously in the previous scrutiny meeting a little bit, is trying to invest to actually tackle the issue. One, reduce the number of families that are facing homelessness and temporary accommodation, and then two, to the extent that we do still have households in temporary accommodation, bringing that in-house to the council so that it saves us money and we don't have the money going at that. To do that, we've requested exceptional financial support from the government of £15 million. To put that in some context, and I joked in the previous committee, it was published yesterday that Warrington have requested £354 million of EFS, so ours is a somewhat smaller amount, but really it aligns to the numbers in the pressure. So the combination of the TA pressure and the housing subsidy benefit pressure, it's to support that, and it's to support not having to make further savings, and it's to support us giving the headroom to make the investment to fix the underlying issue, because actually it isn't sensible, sustainable, or even moral to be just funding the £20 million pressure that's going out the door to the private sector. We've got to fix the underlying issue, and that's why we're taking or requesting EFS. Just a quick comment on the in-year position, which is that at month 9 we have a forecast overspend of £4.8 million. That's down significantly from month 8, when it was about £9 million. And we do have a plan to try and get us into a balanced position on an in-year position at year end. With that, Chair, I will stop. You may want to hand over to, I think you said Public Health.
Thank you. I will quickly look over at Councillor Alexander, who includes the public health budget. Do you want to get a presentation? Do you want to do your presentation on public health now, or wait until we go through your items later on in the meeting to go through your presentation?
Do it now.
Do you want to do it now quickly and then?
Yeah. So, as it came up at the last budget scrutiny meeting and also following a member question at last week's full council, I want to talk about the ring-fence public health grant in Brighton and Hove. What the grant can be spent on, that's following the national guidelines, and the current spend on public health commission services, direct delivery and council services which deliver public health work. I will also cover how using the underspend from vacant posts is supporting additional council public health programmes in 26-27. So the local government Association guidance on public health grant notes councils have since 2013 been responsible for improving the health of their local population and for public health services, including some services that support children and young people's health, most sexual health services, and services aimed at reducing problem drug and alcohol use. Councils receive an annual ring-fence public health grant from the Department of Health and Social Care, plus supplementary public health funding for substance use and stop smoking services. The core condition of this grant is that it should only be used for the purposes of public health functions of local authorities. So as you can see on the slide, there's public health comes under two categories: prescribed functions and non-prescribed functions. So for 25-26, our public health grant was just under £24.5 million. Plus we received £5.7 million as extra funding to cover stop smoking services and drug and alcohol misuse. We also received an extra £1.4 million as an annual reserve. Each local authority receives a yearly top-up to their grant, as the public health grant cannot be overspent. So, and then of this fund, £2.7 million was spent on council services outside of the public health team to support the wider public health matters. This includes things like the council's flu vaccination programme, the Seafront team for their work on accident and suicide prevention, work on nutrition, our city's Healthy Neighbourhood Fund, the Are You OK programme, work on county lines, the Mental Health in Schools project, specialist drugs and alcohol social care, and rough sleeping services. So, because everyone knows there are pressing health priorities in our city, which include a high suicide rate, higher than average drug-related deaths, and homelessness and rough sleeping are heavily affecting our most disadvantaged residents who have mental health and addiction needs. This will need a new approach going forwards, working with partners on forward-thinking approaches. So in 25-26, a number of vacant posts were deleted to enable the renewed focus on public health work that takes place in other parts of the council. The deleted vacant posts were the equivalent of 4.6 full-time staff roles in total. This has created £306,000, which have now been allocated to domestic abuse-related death reviews and school-based mental health counselling for this coming year. The current underspend this year is largely due to in-year savings from these vacancies and the restructuring of the public health team. The full year savings will be realised next financial year, that's 26-27, and will be reallocated as permanent funding to other council services. Historical underspends have been driven by pandemic-related service disruptions and uncertainties around NHS contracts and integrated care board funding, which delayed expenditure. Public health cannot be overspent. Therefore, any underspend is retained as reserves, which are maintained in line with the Department of Health and Social Care recommendation at approximately 5% of the grant value. And that again is because the public health grant can't be overspent. So how do we get assurance that we're spending the right money in the right place? So the Department of Health and Social Care runs a grant assurance progress, including twice yearly assurance letters co-signed by the Section 151 officer and the Director of Public Health to confirm the grant is being spent appropriately. There is also a yearly detailed return with spend set out against a number of categories sent to the Officer of Health Insecurities and Disparities. I can't say that word, sorry. This department then quality assures the spend and ensures that it is not higher or lower compared with benchmarks averages in other councils. Brighton Hove City Council, along with every other council nationally and in the South East, has just completed a deep dive grant audit with particular focus on the miscellaneous spend section. This return was completed at the end of January and we currently await the outcome. This will be followed by annual deep dives audits to closely examine our spend. So I just wanted to add that bit so you know that there's a process that we follow and it's checked nationally to make sure that we are spending the grant in the right places and for the right purposes. Thank you.
Thank you, Councillor. Councillor Shanks, I see you've got your hand up online. Would you like to ask a question?
Yes. I'm sorry I'm away, but I'll try and I'll put my face up now. Okay, so I was originally concerned about this and I put this recommendation forward. So thank you for that explanation. There are a couple, what seemed to be happening is a lot of the children's services budget was now being, so savings in that were being taken up by public health. If that's okay, I suppose. I wanted to know a couple of questions really. One was about the death reviews on people who in subject to domestic violence, because surely that's the partnership. Those reviews are with police, and there seemed quite a lot of money coming out of the public health budget for that, which I wasn't sure why that was public health. And the other thing was the schools counselling project, and what impact assessment have we done on that? Because it was quite a lot of new money. It sounds a really good thing. I'd like to know what evaluation has been done of that project, rather than using a lot more money on it. It might be better to be in youth provision, for example, if young people who really need that support may not want to seek it in school, for example. So I just want to know if there's any evaluation on that. Thank you.
Thank you, Councillor Shanks. So for the question around domestic homicide reviews, they're now called domestic abuse reviews of deaths. There's been a slight change nationally. It used to be that only domestic homicides were reviewed, but now any deaths resulting from domestic violence that are suicides are now also reviewed. So all councils, unfortunately, nationally, are now having more reviews because we have included suicides. This is something very usual that public health has funded. I've funded it. This is the third council that I have funded domestic homicide reviews in. And you can see from the miscellaneous list that Councillor Alexander presented that anything related to domestic violence is a very normal and routine thing for public health to fund. Obviously, councillors will be aware that we have an extremely high suicide rate, so there's a lot of synergy for us in reviewing the suicides, but also reviewing the domestic violence. death as a result. Yes, and this is something that I have done before, so it's fine and auditable. Regarding the mental health in schools, I'll pass over to Deb Austin.
Thanks, Nikki, and thanks for the question, Councillor Shanks. With regards to the school counselling project, in terms of the evaluation of that, we, as a service, our mental health in schools team pulls together metrics in terms of outputs and impact. In particular, they are looking at diverting children from requiring specialist CAMHS provision. So this is very much prevention, early intervention work that is taking place at schools at a much lower level than would meet CAMHS threshold. By being in schools, it also means that children can access it immediately without having to sit on a waiting list around that. As part of the decision to take forward this schools counselling pilot, there was an offer from the British Association of Psychotherapy that they would formally evaluate it, and that's a piece of work that's in progress currently. Thank you.
Thank you.
Can I just also add, so I was a bit confused with the beginning of your question, but in my view, the money not being spent now by Children and Families team, but is now coming out of Public Health, means that there's more money available in the Children's and Families team, so it makes perfect sense to me.
Yes, it's just that that's the expense of 4 jobs, I think you said, in Public Health. But anyway, okay.
Thank you. Are there any more questions from Mitchie directly relating to the public health presentation we just had? Councillor Hill, then Councillor.
Could you explain a bit about the, you said 4.6 FTE vacant posts were deleted. Could you tell me a bit about what those posts were, what their functions were in terms of the council?
One post was created but never filled. 1 person retired and 2 were vacant apprenticeships. And there's another person who resigned as well. So they were all completely vacant posts.
And just to confirm, in terms of what work they were doing in terms of public health, obviously there were some that weren't filled. I'm curious also as to sort of the reasoning for that, but also because we've obviously had a lot of, there's been an inability to hire non-essential posts as well. So I'm wondering if it's related to that. Sorry, that's 2 questions, but one, what was the work that was being done by the deleted posts within public health? And then secondly, was this connected to spending controls? Yeah, sorry.
No, it wasn't related to spending controls. It was just looking at reviewing the work of the public health team and dispersing it a bit more efficiently across the existing team rather than having particular people doing something. Thank you, though.
I can come in on the detail of the posts that were deleted, one of which was public health consultant role. That post had been vacant, and that's a very expensive role. So that made up the majority of the £306,000 saving. There was then also a vacant post in the Healthy Lifestyles team that again had been vacant for a number of months, and that work wasn't going forward. And I can go and get my computer and give you details of the other 2.
Thank you. Councillor Azizuman.
Thank you. As you mentioned, our council is looking at different ways of using its ring-fence public health budget. How have these changes been informed by a commitment to reduce health inequalities?
So all the spend in public health can be, as you've mentioned, it can be on public health commission services. So that's sexual health and family planning, drug and alcohol, 0 to 19 and behaviour change. But it also encompasses the public health work that the rest of the council does. So going back to Councillor Shank's query, early intervention and prevention in children's mental health is also a part of public health and very aligned with that. So all the spend, when I and the Section 151 officers sign it off, all goes towards health inequalities. It should all be addressing those and should be a strand woven through everything that we do. Thank you.
Thank you, Chair. Councillor Hill, I can come back with the specific details you were asking for. So the refocus of the public health grant spending involved the deletion of, as I said, a consultant in public health post, a public health principal, active for life sport and physical activity worker, a community sport and health apprentice, and a community health trainer apprentice.
Thank you. Councillor Lyons.
Thanks, Chair. Suicides were mentioned earlier on, obviously a very serious subject. And please, you mentioned, unfortunately, Brighton and Hove has a very high rate. It's about 40 deaths per year, I understand, one of the highest in the country. 16 people per 100,000 die that way. So my question really is that in regard to the measures that and the cuts that are proposed, how do you think that will affect suicide rates moving forward in terms of prevention?
Sorry, can I ask Councillor Lyons, you mean the change in distribution of funding or overall? Okay. The change in distribution is, some of it is the domestic homicide review, so obviously we'll take that learning because I'm sad to say those tragic deaths were suicides from domestic violence. But as you'll know, the suicide rate is impacted by a number of factors. Could be financial stress, existing mental health patients, and more. So that should be some of it. And then, as Deb Austin said, the school-based counselling is meant to catch children at an earlier stage so that their needs don't escalate to get into a mental health crisis. So both are mental health focused, but as you'll know, suicide requires so much joined up work across such a wide sphere. I can't say this £300,000 will solve everything. It's going to rely on concerted action across the voluntary and community sector, secondary mental health services, GPs, and more.
Thank you. Councillor Parrott.
I just wanted to ask if there's stress in the system or in the budget, because obviously with the link now between, that the focus from Vogue is linking back in with suicide, death by suicide, which of course has often gone unnoticed, and people have, so we have a bigger focus on that now. I would wanted to check that there was stress in the system for that, because we could actually end up with, unfortunately, more suicide that need to be investigated and looked at under the Dada. And the other thing I just wanted to say in response to Councillor Shanks's point about counselling in schools, I worked as a counsellor in the original project that was here in Brighton and Hove many years ago, 20 years ago, and it was hugely successful, and a lot of children accessed that actually who were under Vogue. So children who would have been very frightened to have accessed any support outside of the school system were able and free to do that. So, it's brilliant. Please, if we could have some more, I would be delighted.
Happy to take that, and thanks, Councillor Parrott. Vogue is an interest of mine. We're looking to see what more we can do. I'll be joining the Community Safety Partnership, and it's a hidden problem. It's something that people out of shame don't speak about a lot, so I'll be very interested in working with the voluntary and community sector to see what innovations we can do, in particular on perpetrators as well. Thank you.
Thank you. Do we have any more questions for Mitchie in relation to the Public Health Fund? No? Right. Councillor Matthew.
Thank you. Apologies if this question has already been answered, but I'm following on from Councillor Hill. On the underspend on posts, how is that actually impacting and influencing a failing on provision for those most vulnerable? If anyone present can actually give an insight into that, how we can actually justify not filling posts which are intended for that provision. Thank you.
Thanks for your question, Councillor. In terms of the posts that have been deleted to free up that funding, as I said, one of those is a consultant in public health. That's a management post within the public health service, and that is by far the greatest saving, for want of a better phrase, around that. The other posts that have been deleted are around sport and physical activity, community sport and community health. So in that sense, those are part of the work that's happening, not with the most vulnerable members of our city. So those works, for example, as Councillor Alexander said, around the core services that public health team needs to provide around substance misuse, for example, mental health, sexual health, those aren't impacted by these posts not being filled. They're around healthy lifestyles.
Can I just make a quick point on vacancies? The first thing to say is, and I acknowledged it at Cabinet, that we have been holding vacancies for a while. I know that was separate about the ring-fence public health grant, but as a general point on vacancies, we've been holding them for some while, and we acknowledge that is not the way you would want to run a council or organisation. What you really want to do is set a budget at the beginning of the year with funded posts, and then recruit to that and then manage within budget. Because of some of the extraordinary pressures we have been holding vacancies, and we have to acknowledge that does have an impact on teams and staff. And as if any staff listening, I want to be clear that councillors do understand and see that pressure, and we realise that teams are under a lot of pressure at the moment. But I also just want to add that there is a very rigorous and clear process for approving vacancies that support important frontline services and urgent posts, and indeed there have been many posts approved throughout the year because they went through the right review process with the chief executive and the directors to say, yes, this is a vital post, we must fill it. In other circumstances, the vacancy has been held and the team has had to spread the work a bit, and then that obviously feed through to budget setting where we're deleting a number of vacancies.
I just wanted to come in and say that although it was 4.6 full-time posts that have now been deleted, we do still have a really large public health team, and we have a larger team than most other authorities, is my understanding.
Thank you. Councillor Winder.
Thank you. I wanted to ask about what the role of the consultant in public health would be. What would they actually be taking on, given that some of these posts haven't been filled, and what would this post be for? Thank you.
The purpose of that specific post was analytical, so analysing data around substance misuse, but we have a very good, with a great reputation, analytical team, so that would have been duplication. Thank you, Councillor.
Thank you. Councillor Hill.
Just quickly, you're mentioning we've got a relatively large public health team, so would you be able to say specific numbers in comparison with other local authorities in terms of that at all?
It may be best if we bring this back at another time, just because we can show you the head count and then whole time equivalence and benchmark. Thank you, Councillor.
Yeah, just as a reminder, we did ask for this to come to a future people committee, so this will be coming back in the next couple of months for us to review more in depth, so we will have a chance to dive into this in greater detail. Right, does anyone else want to ask a question relating to the public health budget? No? Brilliant. Thank you very much. Mitchie, please don't run away. We will want to ask you some more questions in a bit, but thank you very much for your presentation today. Right. So, moving on. Councillor Alan Robbins. Does anybody have any questions for Councillor Robbins in relation to the library's budget? No? Okay, brilliant. Thank you very much, Councillor Robbins. Your contribution today has been very welcome. Right. Councillor... Right, whilst we're there, does anyone have any questions for Councillor Jacob Allen? No? I do have one question for Councillor Jacob Allen. I'm very sorry. I promise it'll be a quick one.
Libra.
The sad thing is I've heard that joke so many times from Councillor Allen that if I had a penny for every time I heard of it, I'd probably have enough to start my own bank. So, Councillor Allen, I know that your digital innovation strategy will fall under the Place Committee for the bulk of scrutiny. However, with the Capital Investment Fund of 1.2 million and some projects having a direct effect on this committee, can you inform us what projects directly relate to this committee and how much of this spend is for those projects so we can make a fair assessment for these issues within scrutiny?
Yes, I can. So, as you said, we spent a bit of time talking about IT and digital in Place Committee just before this, which is where IT&D sits. Where my portfolio covers people overview and scrutiny committee is on customer services, people of innovation, HR and staff. So there is still a lot of overlap clearly with our work in IT&D and our procurement of new technologies, especially artificial intelligence. So this is an area where we are planning to invest to save. We want our staff to be equipped with the tools in order to meet the ever-growing pressures on their time. There are many front doors to our council, to the almost 700 services this council provides, where new technologies can aid staff in both accepting those reports and triaging them as they come in. That's something we're looking to explore in the areas of kind of self-service, either by phone or by the website. This previous year, 2025, we launched several AI pilots, of which we are chewing through all the data that's come through from those. Of those were some specifically aimed at customer services, particularly with AI customer contacts and in the council tax department being able to have a single view of council tax debt and arrears rather than the kind of sporadic way it was laid out before. So we're very proud to be investing in this area. It's something dozens of other councils are already doing. At a full council a few months ago now, I was asked, are we inventing the wheel here or are we reinventing the wheel? And we're stealing the wheels that have been invented already in Derby, in Cambridgeshire, in Peterborough, Telford. We're stealing all the best ideas that have already been happening, and we're proud to do so. And that will enable our staff to work at pace, to deal with the many queries that they get, and also to provide a well-run council with efficient services.
Thank you very much. Unfortunately, as you were speaking there, a few hands have gone up, so not as quick an exit as you like. So I'd like to start with Councillor Shanks.
Actually, I think my question was really for Councillor Taylor, if he's still there, because at the last scrutiny of budget, we passed a couple of recommendations which I suggested. One was about council consultations with the unions, which obviously might be relevant to this new increase in IT, and and also the voluntary sector, that we had an account brought to this meeting or future scrutiny, which was agreed by the committee, and then also that we wanted to know what lobbying had gone on nationally about our particular issues around homelessness, because obviously, I think Councillor Taylor actually said this is something, it's a big thing that we have to deal with. Well, why aren't you asking your Labour government to deal with this? This is ridiculous in terms of funding of local government, as we all know. Anyway, so I don't think that those have been answered. But I mean, I'm happy to come back to them after Jacob Allen if Councillor Taylor's disappeared.
No, I never disappeared from budget scrutiny, permanent fixture. So in order, consultation with trade unions. So yes, we consulted with them both before the publication of the previous draft budget and then again before the publication of this budget. I've had 2 meetings with our trade union representatives. And then, of course, the in-depth consultations that relate to staffing posts, those obviously go on alongside the budget and in some cases after the budget. I would flag that there are quite a lot of consultations, and so there's quite a high volume for trade unions and HR colleagues to be getting through. So I think there is some pressure there. But yes, absolutely, both the consultation with them about the overall proposals has happened, and then the ongoing consultations on specific restructures or otherwise are happening. CVS sector, the same. We had a meeting, I can't remember what the date was, but it was around the time of publication of the budget. We met a large group of CVS representatives via the Community Works organisation with representatives of all the different strands, so that has already happened. And then, of course, we are now getting representations from different groups about elements of the budget. In terms of lobbying, yeah, we do lots of lobbying of government and all sorts of areas, from housing benefit to overall settlement to funding for affordable housing. One of the things that we've been banging the drum from the beginning of the administration is for the government to make much bigger capital investments in affordable and social housing, which seems to have been quite successful lobbying, because Angela Rayner, when she was Secretary of State, announced 39 billion of investment in affordable housing, which is happening over the next 10 years. The first rounds of funding of which through Homes England are happening right now, and that we're applying for. So that is something the government have taken very seriously and will support the overall fixing of the problem that you referenced and that we need to deal with, which is, the underlying housing crisis. So I think that investment has been very, very significant. And in a range of areas, we contact ministers and advocate on different specific issues, all the time.
Thank you. Councillor Parrott.
Thank you. Councillor Allen, a couple of questions. I just want to check with changes to customer service. I just want to check that we are working particularly with staff and with officers, to make sure that anyone who is going to struggle with using new technology, either because of disability or, because it's new, and that we are making sure that we've got reasonable adjustments in place, and that we're looking after that. But also, I just wanted to check about residents, because obviously we do have huge areas of inequality in the city, as we know, and we also do have an older population, and I want to be and a significant disabled population, and I just wanted to be very clear that we need to be ensuring that any customer service is still resident facing, and that everybody is able to access that. The other comment I wanted to make, if that's all right, should I just carry on and they can answer? I just want to check about, under my lead role for VORG, actually to do with economic abuse, and that we are making sure that that is built into any AI contact, particularly around debt and anything else that somebody might be coming and approaching us for. Obviously, it's quite hidden, can often be quite shameful for people, and can take quite a lot of teasing out of somebody that's the reason they may be in debt or in crisis. And I would just like to make sure that is being thought through in any. I'm all for AI and using technology, but just make sure that is incorporated into any algorithms, etc., that we're building.
Thank you, Councillor Parrott. I'll go backwards. So on single view of debt. So debt enforcement is currently not an area where AI is implemented. There's a policy we passed in March of 2025, refreshing our corporate debt policy, which has all kinds of provisions for how we deal with financial hardship and abuse and things like that. So I will dig that out, have a refresh to have a look and see if this is specifically kind of factored in, and if not, how we can kind of tack that in to a specific form of kind of suppression of payment. Resident facing, there's absolutely no avenue of contact this council that we are closing, either in this budget or generally in the more medium term future. And first one was about reasonable adjustments. Of course, we have a statutory duty to provide reasonable adjustments. Last year, we brought to Cabinet a new health and safety strategy to kind of build in that culture change work and operationalise it, so that even where people felt they couldn't request that kind of thing, there are now avenues to kind of implement that. So I hope that addresses all of your questions.
Thank you. Sarah?
Thank you. I mean, I'm partly reinforcing the questions that Councillor Parrott has raised, but being here representing the Older People's Council, we're still in a situation where 1 in 3 older people have no IT access at all. And when we look at over 75, 79% do not feel confident at all using IT, even if they had in the past. And so a really huge recurring theme in our meetings and feedback from older people is that desperately need face-to-face contact in terms of customer services, and already find accessing council services actually one of the most difficult that out of all services that they have to access. So yeah, it's some reassurance really that equalities impact assessments are really going to be looked at in terms of this and the advancement of AI, and actually we need to claw back some face-to-face contact rather than losing it. So that would be our plea, and for consultation as things develop.
Well, the council hasn't lost any. I don't know where Sarah's got that from. But of course, we look at all equalities impact assessments. We're committed to maintaining face-to-face customer service, and we've never said otherwise. And yeah, there's nothing in this budget that would row back on that.
Sorry, I think it's already an issue about people not being able to access by phones after a certain amount of time, in the day, and sort of very limited access when we're at the libraries and service desks that just being put onto phones or having to do it through IT again. So I'm not saying anything's changed, but it's something that comes back as a regular theme that people are really upset about. Older people find it very difficult.
Well, I'll take that on board. I would push back that I think our customer service is really good across demographics, especially where further support is needed. Staff in libraries, for example, will sit down with people who perhaps don't have internet access and walk them through one-on-one, online forms and things like that. On telephone calls, in the last 6 months, the council answered over 90,000 phone calls. That was answered. For a city of 200,000, I think that's really, really good. There's always more work to do. There's always more improvements we can make in customer service. But I'm really confident that we have a really good team driving forward digital innovation to give them the tools to be able to do that.
If we could stay in consultation, that would be great.
And just one thing I wanted to chuck in is that we're absolutely acutely aware of digital exclusion, and that some people in the city, including, as you say, Sarah, older people, face digital exclusion. And that's why Councillor Allen has said we're trying to maintain all of our frontline customer-facing services. And as you say, there's always room for improvement. One thing I just wanted to chuck in, which I only found out the other day, is that we do actually, at Jubilee Library, there's a set of free training courses for basic IT skills and digital skills. I think the council funds them, or maybe BIPC funds them, but those are available and I know are taken up by older people, including my mum, the third reference to my mum at committee today, but she's currently doing that. And apparently they're really good courses to help people with some of those basic digital skills. So I think the council's got a number of avenues where we're trying to acknowledge this issue and help with the issue.
Thank you. Councillor Cattell.
Thank you, Chair. This is a question for Councillor Taylor, if that's okay. Yeah, I just wanted to ask about spending controls, sort of day-to-day spends generally, and kind of like the unintended consequences of some of the cuts, or the not cuts but controls on spending. I mean, one of the things that comes to mind, an example I've heard is social workers taking sort of kids in care, foster children out or in care out for a day or something, and not being able to pay for a pizza or something, or having to pay out of their own pocket. And I think this is something that occurs in other sectors as well. But it just seems, I just wondered what your take is on that.
So I'll start, and then Deb may come in on some of those specifics. First thing to say is, as I said earlier, recruitment and spend controls are not the best way to run an organisation. We acknowledge that from the beginning. We've sort of had to do it because of the pressures. The intention, although ultimately it will be a decision for CFO and Chief Executive, is to start the new financial year and not have spend controls, i.e. to set this budget, set the permanent establishment of staff, and then not have spend controls throughout the year, although that will have to be a judgment based on the overall pressures. I think as a comment, and then Deb can come in, is that overall we have maintained a well-staffed children's social work team, and it's great that they got an outstanding rating. We're really proud of the work that they do, and we really thank them for the brilliant work they do. But Deb may want to come in on specifics.
Yeah, thank you, Councillor Taylor. I just wanted to come in on the statement you made about, I think you were referring to independent visitors and the funding that they were in receipt of to take out children in care that they had been linked with. I think it's important to clarify that funding hasn't been removed. That funding has been reduced, so there is still the opportunity and there is still expenses available, but given the financial position of the council across all areas of our spend, we had to look at how we could limit spend. So I think, yes, that has happened, but it's important to note that that money has not been removed. It is still in place and will continue to be in place. Thank you.
Thank you. Councillor Lyons.
Thanks, Chair. A question to Councillor Allen. Thank you for mentioning the customer services figures with a straight face. The feedback I get from residents is not necessarily what you've been saying, but I would be interested if you could substantiate those figures, because if you look at the council's website, there's nothing been uploaded since 2022 in regard to customer services in terms of the figures, the data, the experiences from residents and such. So perhaps if the figures are glossy and better since 2022, perhaps the council website could be updated since then. Thank you.
So we've strayed away from the budget, but this is the chair's meeting and he's allowed the question. I would say Councillor Lyons clearly hasn't read the council plan refresh, which came to Cabinet December, I think it was. The Conservatives never attend Cabinet meetings, only the Green Group do, so that might explain why, but all the statistics are in that document.
Just coming back, well, if in that document, perhaps you'd like to put them on the council's website, because if the public are actually looking for the information, as I say, there's nothing since 2022 on the website. Thank you.
Thank you. I'm not going to ask for a response to that, but just because that isn't budget related, and I think we've got more than enough to get through on the agenda already. Thanks. Does anyone else have a question for Jacob Allen in relation to what we've talked about already, or for his portfolio on customer services budget? No, brilliant. Councillor Jacob Allen, thank you very much. Unfortunately, Councillor Williams, hang on, just before you do go, I've noticed Sarah, is that the new question, or is that an old hand?
Yeah, just one really. I mean, we are genuinely getting a lot of feedback that people are really struggling with customer service, and I wonder whether there could be some sort of recommendation from this group to say that I wonder if there could be some consultation on the development of customer services on the Your Voice thing.
Maybe, and this might be a good idea to bring this as an item to a scrutiny meeting at a later date. Just as interesting as this is, I don't think it is budget related. So can we earmark this as a discussion for a future meeting? I'm getting a nod from Giles next to me. I know he's not on camera, so thank you for that. And any more questions, just before any more questions? Okay, brilliant, thank you very much. Unfortunately, Councillor Williams, I would be calling it, but unfortunately Councillor Williams cannot be here today as she has a meeting with the housing regulator today. But does anybody have any questions in relation to the homelessness budget that they wish to raise? Councillor Cattell.
Yeah, I think Jacob T can answer this. Obviously, we've put in a lot of measures to, especially with the homelessness thing, and I just want to be reassured that we think that we can bring it down to the extent that we won't be discussing the same thing this time next year.
I'm not going to put a number on it. In the previous committee, I said that really our aspiration should be to bring down the net general fund contribution from the forecast 20 million back down to 8 million. That'll have a material impact on our budget. Really, we should be shooting for zero in that it should not cost the council anything in net general fund contribution, but that will take some time. I'm very confident that the combination of measures that we're pursuing, both on acquisition of new stock, of consulting as we have done on the use of temporary voids, but also more work on prevention, will see the numbers come down in this financial year and future years. And as I say, we've got to try and tackle this. We can't simply throw the money at the increasing demand and cost. We've got to fix the underlying issue, and that's what we're focused on doing.
I wonder, Chair, if we could note it down, or if Giles could note it down, that we perhaps have a review of that at one of these committees in some time. I don't know, six months. Do you think 6 months is too short a period of time? Just to see how the figures are going. What do you think?
It's maybe worth noting that we had the homeless strategy last year, and we're due to have an update on that this year. So perhaps we could incorporate that into the scrutiny of that.
Thank you. Does anyone else have any questions relating to the homelessness budget? No, brilliant. Thank you very much. In that case, Mitch, can I ask you to come back, please? I'm imagining we're probably going to have a few more questions with that, as I'd now like Mitchie to come back and answer some questions relating to the adult social care budget. I believe Fiona has something she wished to raise, which she asked me beforehand. So, Fiona, would you like to go first?
Thank you very much, Chair. Councillor Alexander, thank you. I appreciate that you may not have had time to have read the packed position statement that we shared across various budget lines today, and we really hope and we welcome replies on the number of issues that we've raised regarding Wellington House. We fully acknowledge that the proposals around Wellington House will be triggered at budget setting and that a consultation will take place. Specifically for today, because I do appreciate that I'm not going to read through all the points we make in our position statements, we really want to raise with you that community confidence regarding specialist social care provision does remain low in the city. There are ongoing issues. We recognise that both officers and Brighton and Hove have increased budgets, but this is a high cost area for families with high levels of need. And, when I'm talking about Wellington House now, we really need to think about the young people that are coming through who'll be leaving full-time education and will require day services. We have queried the timing of this consultation and the day services recommissioning that is going on. So I'll just make one little bit more of an overview before I get to a specific question. Families with young people with learning disabilities and high support needs, they want equitable and enriching day services for their young people. Costs will be reduced in the long run if young people with severe learning disabilities and high needs have opportunities in the community. So to bring it back to the point, there's community concern. There's always community concern around consultations. You know, there's concerns that maybe consultations sometimes look to be a tick box exercise, and hopefully, you know, we'll see that this isn't going to be an issue like that. So the specific question really I want to ask is, how during the decision making around Wellington House and the broader aspect of day services, how can the council look to rebuild confidence in the community and to ensure that there is sufficient and appropriate services for young people with learning disabilities in the city? That's my main question. Thank you.
I just wanted to say the consultation won't be a tick box exercise. We'll take it very seriously, and any decision to close Wellington House will only be carried through after the consultation, and if we're all, including myself, very satisfied that provision will be able to carry on within the city, and for the current service users of Wellington House and for future service users as well. But I think the other questions I'll go to the officers to answer.
Thank you. Thank you for the question, Fiona. And thank you. And I'll bring in Andy as appropriate. But just to say that the consultation with service users and families will be meaningful. Alongside that, there will be market engagement to work with the independent sector, which is very vibrant in the city. And in fact, the majority of the people that we fund for day services are in the independent sector. I have recently visited some services where I have seen some amazing activities happening, much more vibrant than I've perhaps seen in my previous career in other local authorities, and that's included in London. So I do believe there are real opportunities to be able to do that. Just to give you reassurance that the saving that's aligned to the re-provision of the needs of the people that are currently attending Wellington House is with the intention that they will get like for like in terms of the days that they go and so on. So we will be very much person-centred in terms of the re-provision. And the saving is very much a net saving based on the fact that we will have to pay for people's services as they continue. What I would say is that we have a range of services in the city, and Wellington House is very much a service that's designed around those with the most complex needs, but there is a range of people with needs. What we have in the independent sector is that you can place people to be with providers that meets that individual's needs, which means it's more cost effective, and it means that we have more funding available. Just in terms of your question about the young people coming through, I think that's a really important question, which is why I think as I arrived in the city, the transitions strategy was being agreed with partners, and it very much focused on the fact that we need to plan better as an organisation, but also with partners as well. And we see this as an opportunity to, in the re-provision of Wellington House, look more broadly as well.
Thank you. I'm going to start with Councillor Hill, as I believe the Green Group have an amendment they wish to bring to this item.
Do we do amendments after discussion, or is that?
We'll be voting on them after discussion, but I'd like if you could just introduce it now, just to shape the context of the questioning and the debate.
Okay. So the question. So this is from Councillor Shanks, but I'm doing it on her behalf due to as she can't put it from online. So the recommendation is to pause the Wellington Road Day Centre closure until full consultation has been done. So that's the recommendation, and as I understand it, you'll sort of formally second, but not. Sorry, I'll let you say about that.
Yeah, well, we'll come to seconding and getting through all that later on in the meeting. So I'll start with Councillor Taylor.
Well, I just wanted to say, clearly, we're not on the committee, so we won't be voting on this. But I mean, I would just want to be really clear that amendment or recommendation is exactly what is already happening. So I realise the sequencing is sometimes tricky and difficult when we think about budget proposals versus actual consultations, but absolutely not. Budget is a resourcing decision. It is not a final policy decision, and it is not an outcome and service decision. So the full consultation will absolutely happen, and there will be no closure of Wellington House until there's been a full consultation, and as Councillor Alexander says, until we're happy, including me and the rest of Cabinet and administration, that's been carried out properly and that the alternative options are there to change that overall service provision. So the amendment is exactly what is already in the budget papers.
Yeah, I've got a few people online. I've seen Councillor Shanks. I will be coming round to her again for questioning as well. Let's get through some of the names I've got on the list quickly. Sarah, did you want to go ahead?
Thanks. Yeah, I mean, we've just had a People's Scrutiny Committee on adult social care, as everybody here will know, and the fact that it's got an inadequate and requires improvement CQC inspection reports on various aspects. And I think at that we're really saying that this feels to me like a systemic thing that's actually been encroaching for many years as funds have been directed towards the most complex and highest levels of needs, and we've lost so many of preventive services. That's probably resulted in this hiatus, and you know, services are really struggling clearly at this point in time. And one, is it really realistic at this point in time to be making a 2.9 million savings from adult social care, especially when you've got extra expenses going on, like 85,000 due on a consultant? So that's one question. And in a way it relates to Wellington House as well, because it's sort of almost another preventive service. The day services went in a lot of other adult social care services. Now we've got sort of crises when people do eventually need care, they need to go into residential and things. So I would have real concern about preventive services going, not just for the people who are using it now, but people in the future, to have preventive resources for the most complex people. So the other question really is, please can the equalities impact assessment be reviewed on the adult social care funding proposals, because it's throughout it's saying that there is no disproportionate impact on people who are either older, have disabilities, or economically disadvantaged. But actually, you know, it's 60% of users of adult social care are older people. People who are economically disadvantaged don't have the same choice and control over services, can't choose to go into residential care in the same way that private payers can. So I'd really ask that the equalities impact assessment is really reviewed, and that consultation on this, again, it involves older people's organisations. Thank you.
Thank you for the question, Sarah. So in terms of the additional line that we're talking about today, that has a value of 400k attached to it, and I think I heard you mention about the 2 million, which was the subject of scrutiny last time, and probably attached to the reablement work that we'll be doing. We did talk about investment and invest to save. I think that's where you're referring to the 85k. And that would be a qualified OT who would be helping us to widen access to reablement services, which is absolutely in the preventative space.
How do we help people to regain or maintain their mobility and their independence rather than need expensive services? You mentioned about our RI rating and the fact that there were elements or one element in relation to access to services which was inadequate. And it's just really important to say that the council has an improvement plan which is absolutely focused on how we address the issues around the delay in being able to access an assessment. But most importantly, when you look at the narrative of the report, what it says is that once people do get services, they are served well in Brighton and Hove. And so for us, in terms of the day services, what we're saying is that we are working currently with 6 providers in the independent sector who are providing really good services, and we want to be able to widen the access for people and modernise the offer so that it promotes independence, promotes employment. For example, if you look at the services that Team Dominica provides in terms of being able to work in pubs and cafes and so on. So absolutely hear your point. And in terms of the consultation question, the consultation will absolutely be not just with the service users but their loved ones. We do recognise that those that attend day services tend to have older carers in terms of family members, so we absolutely hear your point and that will be part of the consultation.
I just wanted to make one other point, which is just to be clear that it is not a proposal to stop day services for the service users. The proposal will be, but to be consulted on and to be properly explored, to provide that day service in other settings. I believe each of the people who are service users currently using Wellington House, we're all subject to a care review under the Care Act, and that will happen again. So these are services that people are quite rightly entitled to. The proposal is about whether those can be provided in independent settings. So there will be continued day services. It's just about where those are provided.
Can I just come back very quickly on that to say I understand all of that, and that's been tried, as a system for many years to individualise respite care, but there is always a point at which some people need a very safe, welcoming environment that's not always possible to achieve in the community, just like some older people eventually will need residential care despite all efforts to keep out of that. So I think the loss of day services in the city has been part of what's contributed to the high-end level need that's contributed to the current inspection report.
I've noticed John's got his hand up. Do you want to come in quickly?
Thank you very much, Chair. Really quickly, I just wanted to come in and just make one more point just in terms of the overall adults budget. So I think it's obviously and understandably, when we look at the budget proposals, we look at the savings, we look at income generation, we look at changes that that we're making. I think it's worth looking at the overall budget, and actually we are putting quite a significant amount of investment into the adult social care budget. So the adult social care budget goes from about 152 million to about 162 million next year. That's as a result of inflationary pressures, as a result of making sure that we have enough funding to deliver services, to make sure that we have enough funding to be able to meet the demands of the service as a whole. And yes, against those there are some savings proposals, but I think it's worth people understanding the context, which is actually the adult social care budget is going up, as I say, from about 152 million to 162 million next year. So there are quite significant investments into the budget, as well as proposals that are being made to generate savings. Thank you.
Thank you. Councillor Parrott.
I had a million questions, as I always do, but I think really it's more of a comment just to say that I'm super aware of the fact that the community at large is very, very uncomfortable and very feeling very unhappy and feeling very frightened, actually, I think would be the word I would actually use. That's the feedback I'm getting from within the community about the prospect of this. Some of the reason for that is around the cascade, that if we take people with very multiple complex needs out of one area and we put them into other services, because they are, as somebody adequately described it this week, resource intensive, that can have a knock-on impact on other people in the community and on staff and, and other people that are working in those areas. So it really is just to say that, I'm looking forward to, the consultation. I think that will be really important. It really is important that we make sure that we've got the full breadth of people that need to be in that consultation. Obviously, our community partners, but we do have to include not only people with lived experience, but their carers and their families, because that's really, really vital that we start to understand the impact that change will have on this highly complex group of people. And also I'm looking for reassurance, I guess, that the intent of the consultation is not predetermined in that it is to close Wellington House, but it is to consult on that closure and to see if that is in fact the right way to go about. We do have an expert team there that are highly valued, and generally the feedback I get around that team is that they're great. I'm sure there are improvements. In fact, I know there are improvements that could be made. But the feedback about that, the actual team and the staff, is that they're excellent. And so I think that's one of the areas of concern that people have. So I just really am looking for some reassurance that if we are genuinely engaging in consultation, that it is consultation around what the outcome should look like, not that it's a predetermined outcome.
Thank you, Councillor Parrott. In reverse order, really, it's really important to say that it's not predetermined. The intention is that we will be engaging and listening really carefully, assuring ourselves in listening about whether there really are meaningful alternatives for the people currently attending Wellington House, and then reflecting on the information and discussing that with the relevant cabinet member and wider cabinet members in terms of what we think should happen next. I think the second point that you make about in looking at those alternatives, what that would mean for the people that are currently in the services already attending, that is absolutely how providers of services will always think, whether it's in daycare or residential care. They will always think about the impact of someone new joining, not just about the person who's moving into that space. And providers pride themselves on the fact that they are thinking about the whole and not just the individual. And so we would be working really carefully, and that's why the market engagement would be very much thinking about the mix of needs that we would be talking about in terms of the individuals. So just to be reassured that it's not just about the council, but it's about how we work with partners as well.
Just come back on that as well, and also thinking about the staff that work there as well, because obviously this is a period of time that's going to be really, really unsettling. They're already doing a highly difficult job that most of us couldn't even entertain doing, for a long period of time. These are highly skilled people that I would suspect we don't want to lose from from the sector, whether it's employed by us or employed by another, but some people that we don't want to lose from that sector. They're obviously going to be feeling really, really unsettled and unsure. And I'm just wondering if we, to make sure that we are aware of that and cognizant of that, and that we're looking after those people as well.
So I can give you the absolute assurance that we are looking after the staff, but appreciate that in trying to take a meaningful and caring approach with them, the news is difficult to hear that this is something that we want to consider as a council. The recommendation is not a comment on those individuals who, as you rightly say, go to work every day to do fantastic work with the people that attend the services. The issue is about how do we have really modern services that are cost effective as well. And so we will be supporting them in terms of thinking about, if the decision is taken, redeployment opportunities. We would be supporting them in terms of our employment assistance programme, in terms of their emotional well-being, and of course we're working alongside the unions as well.
just one final point. There is a wealth of expertise there, particularly in the transitions programme. You know, we've got a really big wealth of expertise. I know a lot of people use it informally as well as formally as a service to go and get advice and help about how their young people are transitioning, because of course that is a point at which young people, you know, are transitioning out of children's services into adult services or under that auspices. That's often where things go wrong for people and they fall, you know, the world can fall apart.
Thank you. Councillor Shanks.
Thank you. I mean, yes, of course, we get that there'll be a consultation. The issue is this is a political decision to make the saving, and we're always under pressure as politicians to cut costs, and this is a saving because we all usually reckon that the in-house services are more expensive than outsourcing. But there is a lot of issues, as I think Sarah Fulford said earlier, that mean the decline in in-house services. I think actually Councillor Taylor at the beginning, when he was talking about housing, said how important it was to maintain our in-house services. I just wondered what principle there was in you know, in terms of this administration, whether you want to do that. I know that a load of in-house services have gone over the years, and I'm very regretful about that personally. But also from our point of view, when we've been in helping to make those decisions, because there is pressure from officers on savings. But it's, you know, the VCS are saying they don't necessarily have the capacity to take this on. The staff there are very unhappy, and I think that's the problem. It's just, you say it's a consultation, but once it's in a budget, we know that generally that happens. And, you know, other things have happened in the past that I think you shouldn't have let happen. So I would, you know, the amendment is really to postpone it, but really it's not to do it, not to put this cut in the budget until you've actually had that consultation. See where else you can find that money from. It's not a huge amount, to be honest, in the overall context of the budget. Thank you.
Let me come in, Chair, through you, if that's okay, and answer a couple of points there. There's a big question there about the provision of services and in-house versus provided outside the council, either in the independent sector or the private sector. This administration has not moved lots of services into the private sector. If someone wants to correct me, I don't think we've really moved any services into the private sector. There have been examples where we've ended up re-providing in the VCS sector or third sector, for instance, the lifeguard service going to RNLI. We've also brought in some services back into the council, and indeed, you know, over the history of the council, Labour administration brought back in-house housing repair services, for instance. And by the way, our housing repair backlog has come down significantly in the last 2 years since we've got in, including with extra resources to support that. You know, my overall position is generally I would like to see most of public services provided by the public sector. However, we just have to be realistic that in a position where we have high demand for services and we're in a tight financial position, we have to think about where can we best provide those services. Now, you know, that would be my ideological starting point, is that public services should be provided in-house. However, we also know there's lots of great examples in the third sector and VCS sector where actually it's not just about cost, but actually they can be delivered perhaps better and more flexibly. Now, I'm not talking about the specifics of Wellington House necessarily, but that they can be provided better and more flexibly. And indeed, there's something about sometimes communities actually feel more comfortable accessing a VCS provided service as opposed to coming to a council office and talking to a council officer. Councillor Shanks will probably know and remember that for some families, that the council represents, you know, also social services and the consideration of interaction and child protection, etc., and that we know that those families will feel more comfortable talking to a charity or a VCS organisation that's based in the community. So I think it is a mix. There's no overarching ideological position saying we have to have everything in-house or we have to have everything out-of-house. We haven't really privatised anything under this administration. What we have done in some circumstances is move services to the VCS sector, and in many cases that can be good provision. In other circumstances, and the one you referenced, Councillor Shank, It's about saying it's very clear to me that having a privatised model of TA and emergency accommodation is a total failure of the system. Total failure of the system, because why would you be transferring pure taxpayer subsidy to private landlord provision of EA and TA when we know that if you could acquire the properties in a way that's financially viable through borrowing and then paying back through the rents received as a net neutral position, why on earth wouldn't you do that? Clearly, we've got to put in the capacity to be able to acquire enough properties quick enough, but the two things are not inconsistent at all. And Jeanette, did you want to come in at all on?
No, you've said it really well. I was going to talk about the fact that we have in-source services, not just in housing, but also in adult social care, so things like our shared lives. We are keen to make sure that where we feel that that we are best placed as an organisation to provide services, so things like Craven Vale and Island Lodge, we absolutely are investing in and thinking about how that helps to respond to the points around early intervention, prevention, and meeting unique needs that clearly the independent sector cannot respond to.
Thank you. See about those last two. I'm glad to see they're not coming up this time. Craven Vale and Island Lodge, they used to come up all the time.
Thank you. I was going to go to Councillor Lyons next, but due to the heavy referencing of the VCS sector, I'm going to call in Joe Martindale now.
Thank you, Chair. I wasn't actually intending on talking about this, and maybe I'm not saying something very new, but I wanted to thank Councillor Taylor for what he said about services needing to be delivered where they're best placed. And sometimes the community voluntary sector is the best place for a variety of reasons. However, I put my hand up before he said that because I also thought a comment about Wellington House was really important, to say that this is an opportunity for the council to build trust, actually, because change is always hard. And Wellington House is a long-standing provision. And there are potentially opportunities if you do, the consultation is one thing, but then the next thing that is even more important is really good co-production with people who might use the service, people who have used the service, and people who are using the service. Because potentially there is a way that service could, when was the last great big review of the way this kind of service was? It probably hasn't been, I don't know, it's not my field, but I don't think it's been done in in the last 5 years. So a really, really good look. We could find that we procure something that actually meets the needs of those families better. But to get from where we are here to there, we need to build trust, and we will do that by communicating really well, being honest, open and transparent, and acknowledging that for anyone using the service or anyone working within it, that change is hard. And the more that the process can be handled well, I think we potentially could reach a good outcome here. And that contracting with the community and voluntary sector isn't privatisation. I don't know whether there is an organisation in the community voluntary sector that would be interested in delivering this service or not. I think until you know what service you're trying to procure, you can't possibly know if the interest is there. So I guess that's the plea when we make changes in our services, that we do that co-production and we do that honest communication, because that is how we provide the reassurance that actually delivering the right service is the thing that we're trying to do, not being hung up on where or by whom. Thank you.
Just to say that that's really helpful feedback. Thank you, and I think that's very much the sort of spirit and intention of what is going to go forward. I just want to repeat what I said earlier to a question, which is this is a genuine consultation. We pass a budget every year, which what the budget simply does is set the amount of money each department gets, and within that you recommend various savings, some of which can happen straight away. If it's putting up parking by 3%, that happens straight away and it's simple. Others are much more complex, but I want to repeat, this is a genuine consultation, and if we are not satisfied as cabinet members and officers that the service can be re-provided properly as well or better, and that the sector cannot support it, then we will not proceed with the proposal. It has to be genuine, it has to be real, and it has to be, as Joe says, an opportunity to make sure we get the services right and we properly consider the service as a whole.
Thank you. Councillor Lyons.
Thanks, Chair. Yeah, clearly this is a very emotive subject, but on the hard, cold face, I can, I had a resident come to see me fairly recently, and if, the closure of Wellington House, if it did close, would be absolutely devastating to this particular family. The question that they ask, and I need to, I don't know the answer to, and perhaps you can help. The idea that one person can be provided to support them in the community obviously can be damaging to those with learning disabilities. But what concerns me is where are they supposedly going to get this delivery of the service in their own home, and also the pressure on the parents or the carers, getting respite care. So, I would like some response to that. But in regard to the savings, you mentioned the £400,000. The new provider is supposed to have obviously all the same requirements that the council will need when providing care in such a setting, obviously electricity, staff costs, feeding, etc. So could you actually perhaps explain that if this were to happen, where the savings are meant to come from? Obviously some mention has been made of the private provider, can they do it cheaper, but where would the savings come from? Thank you.
Thank you, Councillor Lyons. So, first of all, if you've got an individual family that has concerns, please do share those details with myself, and Andy and Steve will work with the family to answer any questions. So just that's the first thing to say. In terms of your question about the saving, let me just go back to the question about the re-provision and an individual being supported in the community. When we talk about them being supported in the community, that may be with another provider of services, so it wouldn't be necessarily that they would be expected to take part in mainstream services. They may go to another provider. We have 6 other providers in the independent sector who are providing day services, and so that's one of the options that we would be looking at. It may be that some families may take the opportunity to think about direct payments, where the model you described may happen, but that would be a genuine choice on their part. We will make sure that we think about what it is that they feel is most appropriate. In terms of the saving, at the moment we have 21 people over the course of the week attending Wellington House. That, at the moment, based on 21 people attending, has a day cost of about £220 a day. Now, that is more expensive than any of the offers that we have in the community, and it's based on those with the most complex needs that attend the service, where in fact only 9 of the 21 have very complex needs. So if I tell you that in the context of the independent sector provides for a range of needs from low to very high, the rates that we pay for those meeting those needs is £60 a day to £200 a day. And so it depends on where those people would decide to go based on their need. That's where the saving would come from, because as I said, we would absolutely be paying to replicate whatever provision they currently have in Wellington House, whether it's 2 days a week, 5 days a week. We would be re-providing that to meet the needs of the family and the loved ones who may rely on that for respite.
Thank you. Anna Suri.
I'm happy for you to speak because I think you are speaking on this item.
Thank you, Nishri. Chair, I'm sure you'll bring her in afterwards, but thank you, Chair. I'm seeking, like many people in the room today, I'm seeking reassurance on behalf of parent carers, and I do I have heard the reassurances around the consultation period. I just specifically wanted to bring up the fact that I know you're talking about the 21 service users at Wellington House at the moment. What PAC also know is there are 17 young people leaving full-time education at the moment, all with high support needs. So there's a mathematical issue here. We're hearing, and I'm very happy I know that some of the councillors would have shared, hopefully will have shared emails with officers from concerned parent carers of young people with very high needs. But just to sort of maybe reflect in the comms that will be issued around the consultation and the reassurances that are needed, just to really make live in the room today that the transition strategy that you speak to, I mean, currently the aspirations of the transition strategy are hopefully going to be impactful going forward. However, the issue remains that the adult CQC report showed that there are lengthy overdue assessments that I know that we can see that the action plan are dealing with, but actually these overdue assessments include the annual assessments of the young people leaving full-time education this year. That they are delayed and the outcomes of the assessments are yet to be known. So the other point that I want to raise, and I just think it's important because I know we have families in the community who will be listening to committee today. Because there have been overdue assessments, and this is again in sharing confidence, and I totally agree with Joe's point, by the way, about meaningful co-production and how useful that should be going forward. But because there are such overdue assessments and parent carers are waiting to see what will happen to their young people when they leave full-time education in July 2026, families have been using their own initiatives, and they've been going to the day services that you talk about, and they're being told, Ambito is saying that they are full, Grace Era saying that they have concerns around physical space. Now, I know that, you're clearly showing that you're going to be talking to these providers, but this is context that you really, really need to hear around reassurance and then delivery. So thank you for letting me come in.
If I may come back on that point, because I want you to all be reassured that we as officers are hearing very clearly the concern and distress that is clearly being felt by not just those that are attending the service, but those that are thinking into the future about where their young people will go once they leave education. I recognise that many of the services that are in the independent sector do not have many spaces left. And in some ways, that's not a surprise, because although they are not-for-profit organisations, they do run in a business-like way in that they have to have full cost recovery. They cannot afford to subsidise the council in terms of when people may be coming. And that's why the market engagement that I've described is really important. If we can talk about the number of people we think we would be wanting to fund, then those organisations will think about how they can respond to that. And I think that's why it's so important, and the transition strategy talks to that, the point about how we plan better together rather than it being a surprise that there are young people that have grown up with disabilities that will need adult services. So absolutely hear your point, Fiona, and absolutely want to say that officers are in some ways keen to grasp the challenge, and I think it's a correct challenge about how do we communicate better, how do we co-produce so that I don't want to use the word positive experience, but so that it is a meaningful experience in terms of how we go forward in terms of the potential for re-providing from Wellington House and meeting the new need that's coming through.
Thank you. Thank you.
Thank you. Anna-Sari.
Thank you, Chair. I want to start by acknowledging the very significant financial pressures, faced by local government, and the scale of demand in housing, adult social care and children's services, and it's clearly intense. And I recognise the difficult choices that are having to be made to make a lawful and balanced budget. And notably, we're very grateful as a voluntary sector for the important work, around TCEF and the Community Catalyst Fund, and they were not cut, and so it's really very much appreciated. Much of the resources in the councils are necessarily concentrated in high-cost statutory responses, also completely acknowledge that, and they are expensive interventions. And I know that all the portfolio holders and SLT understand the value of prevention and the difficulty in trying to implement some of that. And I wondered, and I hope this is not a foolish question, and I feel a little foolish asking, but if you did have additional resources, what one intervention would you pick to help support your services? Because I feel, the year will go by really, really fast. And then again, we'll be asked for a pound of flesh again. So if we are serious about that sustainability and financially and socially, what will enable that earlier engagement and the stronger community-based support? And can we please engage with the voluntary sector earlier? So we now know, you've told us there's going to be more cuts. What can we do now? And think about what we do then? Because sometimes it comes too late. And how can we sort of think about and plan it really, really early so we can put that in? So I'd love to hear your thoughts on that. Thank you.
I'll go first. It's certainly not a stupid question. It's a very good question and quite a difficult question, which is why it's a good question. But so I'll just go a bit high level, and then Jeanette might come in. What you're drawing out is exactly right. Is that we've got this balancing act of we've got these high pressures on cost and demand that, in my view, are a reflection of underlying issues, and I won't get into too much politics, but underlying issues that have arisen from austerity, but also the cumulative effect, particularly of the housing market and the structure of the housing market. So what we want to do, and what I think the government want to do across a number of areas, is try to get into the preventative space and the invest to fix space. But at the same time, we're juggling this immediate demand pressure on the budget. And so it's difficult to do the two things at once. If I was to answer your question more generally across the whole budget, I would come back to housing, because I just feel that in this city, it's so chronic, the unaffordability, that I think it drives so many other things. It drives the overall level of inequality. It drives pressure on families. It drives ability to actually get good employment, because the pressure on housing is so great that it stops you. We talk about social housing, and I recite a story that I told the other night at an event that Councillor Robbins once told a committee, which is that Councillor Robbins, who grew up in Portslade, was born in a council flat and lived in a council flat. His sister, when she was 19, who was also living in that council flat, who was working, became pregnant and came to the council and to seek social housing. At that point, the housing department said, here's 3 sets of keys, have a look at 3 properties around the corner, come back, tell us which one you want. So just imagine that as the status of housing, and imagine that as the impact on Alan's sister at that point in terms of her ability to then say, okay, well, I've got some settled accommodation almost immediately, and then being reassured that once she's had the baby, she can go back to work and not worry about precarious housing. So to answer your question, if I had a huge chunk more money, I would focus on trying to really, really tackle the housing issues in the city that would both feed through to reducing the budget pressure on homelessness, but also, I think, have a lot of other impacts across inequality, life outcomes, families in the city. But Jeanette, I don't know whether you wanted to say anything else about...
Yeah, so you've spoken to housing. If I just talk about adult social care in terms of your question, because it is a really good question, and I think this is why, first of all, in terms of your invitation to think about how we involve partners early. One of the things we've been talking about as a senior leadership team in homes and adult social care is how do we think about the opportunities for modernisation, transformation, which may also have savings attached to them, and how do we do that early and have those conversations early with partners and with the residents or service users of those services. So that's something that we are definitely thinking about going forward. In terms of if I could choose any additional resource, I suppose for me, thinking about the adult social care improvement plan, which is very much focused on early intervention and prevention, it's about how can we do more in the prevention space. Given that there isn't necessarily going to be more money, it's about how do we use the money we have available in the city better and well, and so that's why we're working really hard with public health, who have investment in things like the Ageing Well Service. How do we work together to really maximise the outcomes and bring together the expertise as well as the resources? So that would be our ambition, I think, for 26-27.
Thank you. Councillor Hill.
Thank you. I've got a couple of questions. So, firstly, residents of mine who are affected by the proposals around Wellington House, they've highlighted to me impacts, particularly in saying that staff there are highly skilled relating to their ability to achieve de-escalation in certain scenarios, and more broadly with the, ability of them to sort of help with complex behavioural support. So how will you look at the alternative provision in terms of how staff manage de-escalation to mitigate distress for service users? And I'll just ask my second question too, which is if the day service closure does go ahead, have you considered your options regarding the Wellington House site, which is council owned? Because concerns have been raised with me of the future possibility of the council selling the building for private housing development, which I know isn't what you're consulting on here, but clarity would be helpful. Thank you.
So in terms of the skills of the staff, in terms of de-escalation, absolutely, they are well skilled at that. What I would say is in the independent sector, there are staff who deal with so we have two services that where we fund people that deal with high and very complex needs, and they absolutely have the kind of training that you would see in Wellington House in terms of those skills. And so in terms of the confidence levels, when we would be, if we make the decision to close the service and re-provide, we will be re-provided into a service that has the right skill set for the needs of the individual. In terms of the future of the intentions of Wellington House, you're right, that's not specific in terms of the paper. We would be thinking about that in the longer term, but it is a large site, and we would be thinking about the fact that there are some teams, I think, that are located alongside the Wellington House service. They would be re-provided into other facilities, buildings across the council estate. But that is not something that we've put in the actual budget paper.
So I think it's more of a political question, I guess. Would cabinet members have any comment on that concern around selling the building for private housing development? I know you probably can't say yes, no, but could you comment on that?
Well, actually, I'll say no, because I think that we're way off that, and there's no plans at all. As Jeanette says, there's a team that are somewhat separate to the Wellington House provision that are based in there. It's possible they could move to another location. If that building were then to become entirely vacant, I think the first consideration would be emergency and temporary accommodation and whether it could be converted into that or any other services that the council need or want to provide. That would definitely be the first consideration.
Thank you. I'm just going to ask one quick question to wrap this section up, because you've mentioned a couple of times that you're not going to proceed with the closure of Wellington House without putting it out to consultation, which means there is a chance that on the feedback of that consultation and later discovery, you may decide to not go ahead with this. In that situation, have you got a contingency plan of where that 400,000 will come elsewhere in the budget?
So the simple answer is no, and that's not how the budget obviously works. So you're setting an overall budget framework and resource allocation for each department. If we were to not proceed to it, that would then present itself as an in-year pressure. An in-year pressure could be dealt with in a number of different ways, which might be making savings elsewhere, or it might actually be just managing other types of pressures. I would note, and in the previous committee we looked at it quite extensively, including questions from Councillor Sykes, that we're trying to put in quite a healthy risk reserve into the budget, and that's one of the uses of the exceptional financial support, is to both build up our working balance but also put in a healthy risk reserve in the budget. And so that might be the first port of call to say, if we did not proceed with any of these things that are being consulted on, we would then look to the overall risk reserve. But no, there's no alternative proposal that we would then whack straight in if we did not proceed with this.
Thank you. Does anyone else have any questions in relation to the adult social care budget? No? Then I'm going to say let's take a 10-minute break here before we come on to Councillor Daniel. So 10 minutes, and I'll see you all back in here at roughly 20 to 7. Right. Thank you. We now have Councillor Daniel taking the stand as the final Cabinet member this evening. Does anyone have any questions for Councillor Daniel? Any questions at all?
Should I just do a little intro?
You do a little intro.
Okay, so I think it's important to say that we're actually increasing this budget by almost 5.5%. And so, you know, I know that we keep talking in terms of cuts and savings because that's what you're scrutinising, but there are good things happening to local authority budgets at the same time as we're managing some difficult long-term issues and improvements, particularly over like temporary accommodation, which Councillor Taylor has explained. However, the cost of delivering services goes up with inflation, obviously, and the needs go up sometimes as well, particularly if you're not spending on preventative services, which goes back to the previous conversation around adult social care. So overall, we did need to find some savings in order to, if you like, stand still. And if we want to do anything different or good or something, respond to what children and young people ask us to do, then you need to find savings to enable you to do new things. However, the Cabinet have been really supportive of children and young people, and they feel that the previous government's immoral disregard of the needs of children and young people, including the increase in child poverty and just ignoring what children and young people were telling them for a decade, and that neglect does mean that we, you know, need to really shift our focus onto children and young people, and that's where the Labour administration and supported by a Labour government are doing just that. So we have put savings in this budget, but they are quite minimal, and I'm happy to take questions on those, but I want to also reflect that we're also getting new direct Labour government investment in young people through both Young Futures and through Best Start Family Hubs, which are increasing money at those preventative services, the things that you get when you're 0 to 5, which we know makes the biggest difference to life chances going forward. So all those things are really important. And Young Futures really responds to the fact that young people have been struggling with mental health, employability and options. So the Young Futures hubs and investment will be supporting that work. So I think we have, like I say, we have other good things to say about children's services apart from the quality, which is good. We spend, because we have retained that investment in our children's services, we have very low turnover rates of social workers. We had 0 vacant posts and 0 agency staff, which is, I think, I don't know if any other council can say that in the country, but it's almost unheard of, if not unheard of. That's good for children because they have that stability, and it's good to be part of a workforce that enjoys coming to work and has the sense that they're valued. And that's what those figures tell me. Also, the benefits of good services is they cost less. So we spend 4.7 million less per annum than our nearest statistical neighbours on placements for our children in care. And that's because the services are working as they should. We've got that stability of our workforce, and we've got that preventative work happening that's preventing that spend escalating. We have areas of improvement, and I'm sure that Fiona will want to talk about short breaks. For me, I'm concerned about that, A, because of the feedback we get on them, and B, because we spend 1.1 million more than our statistical neighbours per year. So we're spending more, but we're getting low satisfaction. So we have some work to do there, and we can talk about that. Did I want to say anything else just to highlight at this point? I think I probably also want to highlight nurseries and allay any concerns that members might have or members of the public might have on those as well. So I am expecting questions on that, but if not, Chair, if you'll allow me at the end, I'll just say a few words on that.
Thank you. Councillor Shanks.
Sorry, I'm hiding in a back room now. I just a couple of points. One was the nursery roundabout, the rationale for, re-providing that somewhere it's in our most deprived area, etc. And the other one, very small cut, but youth art seems to always get targeted. I welcome the money that we've had from the government on this youth offer, and I thought we've used some of that in other things that I thought maybe shouldn't, but we've had that discussion before, but maybe use a bit of that for youth arts as well. It's a very small service, but it's a very valuable one to the young people who do it. Thank you.
I'd just like to say you're simply wrong about the fact that we're using Youth Futures money in a way that isn't compliant with both the grant conditions and compliant with the vision of expanding that service. The post that is being funded through that you have complained about, it's absolutely right that we fund that post going forward, but with a different emphasis rather than on protecting and preserving what we have. That role will be about expanding the role we have and working with the wider CVS marketplace and other providers to look at what can be offered. In terms of the nursery roundabout, it is in the most deprived area. There's absolutely no way that we would risk the future of that. Now, mostly councils don't provide nurseries, so it would be something that when a budget is under pressure, you normally would look there and say, well, there are nurseries available. That's not the case for Whitehawk, and it is specifically prioritised for action this year because we want to protect it for the long term. And what I can say about that is that what will be preserved there is the exact same offer for families as is provided now, but it will cost us less. And I don't really see anything very progressive about wasting money. So I'm quite happy to defend that one. Was there a third question in there somewhere? Youth arts. Oh, youth arts. Yeah, I know that you're concerned about the youth arts. We are maintaining the same level that we've had this year, and I've had no complaints come in until this budget was published about the level of service. Additionally, rightly, that should be provided through our alternative provision and funded through alternative provision really rather than general fund, but we are maintaining what we have got in general fund, and that is the right thing to do. And obviously Youth Futures money will enable us to offer much more arts across the board to young people in the city, whether they're in school or using AP. So I think that the youth arts offer is robust. That is a defensible cut, because it isn't a cut. It's just a change.
Okay. I mean, in terms of the roundabout nursery, so I didn't really understand that. You're proposing to outsource that provision, or how are you changing the provision at roundabout there?
Yes, we would be we would be looking at outsourcing, but we would be protecting, but that outsourcing would be tied up in a contract which would ensure that the exact same offer for families is available for them going forward. Otherwise, we wouldn't progress with it.
So there'll be consultation with staff and users as well.
Thank you. Councillor Cattell.
Thank you, Chair. I just wanted to make a comment, if that's okay. I think one thing that, because I've been on the fostering panel for probably nearly 3 years now, it's really good to see that we've got quite a few new approvals coming on. In fact, I'm just looking at the agenda for next week, and there's 2 new approvals coming on of new foster parents coming into our city, and we've had other foster parents moving in from other organisations. And I'm always blown away by the amount of dedication, just the sheer sort of, I can't even think of the right word, but how wonderful these people are. And also a shout out for our lovely social work team, or the ones dealing with them, with the ones that I know who are dealing with the foster carers. And they're just such a lovely bunch of people and very, very dedicated. So well done, whoever's keeping them in check. I'm really impressed with what I've seen over the last 3 years. Thank you. Thank you for indulging me, Councillor.
I'm sure that Deb will make sure that feedback is passed on. And yeah, I think they are a massive part of the reason that we are succeeding as an authority and keeping our budget within the realms that we have been keeping it in. Because it's, if we weren't supporting those fosterers well, and people weren't attracted to fostering for us, placements would be costing more. So you're right to raise that.
Thank you. Joe.
Thank you, Chair. I want to say it's really impressive, the staff retention piece. If you keep staff, you know that you're doing something right. So I think that's really welcome news. I'm going to be like Julie, maybe it's the time of night, but I wanted to do a shout out for the Youth Commissioner at Brighton and Hove Council. It's so wonderful that we've been nominated as a Young Futures area. I think that's an accolade for the strong partnership between the local authority and voluntary sector, actually, because it's the Department of Culture, Media and Sport who we've been working with very closely over the last few years on our YIF funded work, both in the centre of the city at BYC and over in the west at Hangington and Knoll. So I think they've seen that and they want to learn from our approach, and long may that partnership continue. It's bringing resource and investment into children's services. We've talked about prevention on the adult side. We definitely need to think and do more. But in one way, if we invest in our young people at any level, that is prevention. So I just wanted to say that actually this is all pretty welcome. Thank you.
Thank you. Fiona.
Thanks very much. Yeah, Emma, thank you, Chair. Emma, I will come back on short breaks and just hopefully offering to the room and the Labour administration the sort of the national context a bit around short breaks. First of all, I wanted to say, I really appreciate your ongoing commitment, the commitment that you made publicly last year about looking to ensure that children and young people with learning disabilities and high support needs have the opportunity to socialise in the school and college holidays, and for acknowledging the problems in delivering the number of sessions that would be desirable for children to have that opportunity to socialise. So I'm acknowledging the intention and your commitment to look at it. I wanted to come back on the statistical neighbours issue, because there's naturally a logical financial comparison to be made with statistical neighbours, but I think it's really, really important for Brighton Hove City Council as decision makers to really look at the national picture here. Whilst Brighton Hove may be spending a lot more on short breaks, there's lots of other areas that are performing incredibly badly, and other parent care room forums in the country will say that their short breaks offer is significantly smaller. So in the position statement that, again, I acknowledge I only shared today, in looking at this overall context, and Jacob, you've talked about, lobbying at national level, short breaks is a national lobbying issue, but I'm going to point to the useful context that the national organisations are making. The Disabled Children's Partnership Board, which I provided a link to in the position statement, talk about the national failings around social care provision and short breaks, and there's a really relevant report, which I think it was dated 2023, but I think it's still very relevant, called The Loneliest Summer. Contact the national charity who are the spokespeople for SEND in the country. They talk a lot about the chronic issues and chronic shortages within short breaks. So I think it's really, really important to sort of see that your issue around the spend statistically, there are issues in the fact that there is a low provision nationally. And the only other thing that I wanted to mention in my role as being a spokesperson for PAC, is the difficulty is that you're always going to have the pressure and challenge from an organisation from PAC on behalf of the families that we're talking about, because the equity issue is that for children and young people with high support needs and their non-disabled peers, the offer remains small. And also looking at the excellent and really developing HAF programme, which I'm really supportive, and it's an excellent programme, but actually there's an equity in there in what's available sessions-wise for children and young people in the HAF programme to what is available within the short breaks programme. I do recognise that commissioners have been working to try and get more eligible short breaks children and young people into the HAF programme. But these are the intricacies of the problems with inequity. So I just wanted to give a bit of context. I hope that's useful. I have got something else to say about SEND employability, but I'm sure maybe you want to come back to the points I've just mentioned.
It's difficult to come back because I think all I can do is note your comments really about the fact that after a decade of not having the resources being cut right, left and centre, that things still aren't in a good place nationally. I agree, and I think I've done what I can in terms of budget setting to try and be fair and try and put money to the more high support children at council level. And I hope that at national level we'll see improvements too. I think that's all I can really say there.
Yes, thank you for acknowledging it. And PAC seek to work alongside officers and lead councillors like yourself in this area, and we've got the rollout of the 2026-27 short breaks programme, which again I just hope will be an area of. Well, I'm reassured that it will be another area of scrutiny at councillor level. So thank you.
Thank you. Does anyone else have any more questions? Councillor Desmond.
Thank you, Chair. I got very small question to Councillor Daniel. Are there local strategies to reduce relying on high cost of external placement?
Yeah, there are some. That's at the core of everything that is being done. So right from the family hubs, which are the very earliest intervention, trying to make sure that we're working with families to prevent need escalating, to the recruitment of foster parents so that people can stay local to their networks and avoid high-cost external placements. And we're also in the regional care cooperative, which helped us develop the new care home of our own in the city, Rainbow Lodge. And then I guess on top of that, I would say that if there was an area of concern for me and an area that we want to really look at costs and quality, and this is national, it's not just for us locally in the city, but it bothers me a lot, is the quality of care placements for teens who have complex needs. That's incredibly expensive, and I wouldn't say I was satisfied with the quality. I don't know that the outcomes are what I would expect. So that we kind of are where we are a little bit with the national picture, but that's something that I want to focus on going forward.
Thank you. Councillor McKay.
Thank you, Chair. I really am appreciating how much we're focusing on prevention in terms of limiting the disadvantage that some people in our communities have. So I think that's wonderful. Can we be assured that our most vulnerable children, whether they're in care, moving out of care, or in schools with special educational needs and disabilities, living through their school curriculum, their school years, and moving into adulthood, they are not going to be disadvantaged by this budget and our decisions?
I'm absolutely confident that this is the best place we could be in within all of the constraints that you have as an authority going from year to year. And I think what's important, Councillor, is also that we have a medium-term plan. So we have financial plan, around where we can move resources much more to the prevention end, and we continue to work very well, I think, on that track. Additionally, I think, it's just gone. I just wanted to say something. Annoying. It's gone out of my head, but I know Deb wants to say something, so maybe it'll come back.
Thank you, Councillor, and thank you for the question, Councillor. Just picking up on Councillor Daniel's remark there around the importance of the preventative agenda. What we know is that once families get into our specialist services, that we provide a good level of support and services there. That's being evidenced by our Ofsted ILAC's outstanding rating from 2024. What we're in the middle of is something called the Families First Partnership. That's a transformation programme that's nationally mandated. It's going to be in the Children's Wellbeing and Schools Bill that is currently making its way through Parliament. That is around bringing together family help with those specialist services. There's additional funding that comes from central government for its ring-fence grant. It's an additional 1.1 million for Brighton and Hove. Children's Services, something obviously I'm incredibly happy about, but that will enable us to continue to provide really good services, but to make sure that they are at the earliest stage possible. Through that approach, I'm assured that we're providing services for our most disadvantaged and vulnerable children, because those are the children that access our services and require the support.
I remembered it now, so it was because I know you come from an education background. I wanted to mention the really good progress on our alternative provision programme. That was picked up in an inspection as an area that we could improve on. And I just want to compliment Georgina Clark-Green, because the acceleration of AP classes within mainstream settings, making sure people have the same routine as their peers, maintain their friendships and relationship to school is really good. And I really enjoyed visiting Rudyard Kipling. Such a great visit. And I know that a lot of you heard the head talking about special educational needs. So yeah, I'm really pleased about that, and that's going really well.
Thank you. Are there any more questions? Okay, Councillor Daniel, thank you very much. That is the last Cabinet member we are due to be speaking to today. Does anyone have any questions for Councillor Taylor in general about anything before I move to the final stage of this meeting? No silence is golden. Absolutely amazing. So we have one amendment that has been asked to come here today. Councillor, do you just want to quickly remind us about this amendment?
To put to me. Oh, sorry. Thank you. It would be recommendation for pausing of Wellington Road Day Centre closure until a full consultation has been done.
Thank you. Before I speak to this very quickly about my position, does anybody wish to second this amendment from the floor? No? Okay. I will second this, but I will not be voting for it. I don't believe it's right for an overview and scrutiny committee to recommend that the Cabinet continues to do what it's doing. We are implicitly doing that when we agree to note the reports but from the Cabinet. So I think we'd be doubling up on the paperwork we've already done. So I will be seconding it to put it to the vote. However, I will personally be voting against it. Does anybody else any voting members wish to speak to this amendment before I call it to vote?
Can I just make a comment? So my understanding is that it's not going to be closing because it's all subject to consultation anyway. So isn't it pointless, this motion?
Yeah.
However, it's been asked to go to a vote, so I will put it to a vote in the name of fairness and democracy. So, anyone else wish to speak to this? No. In that case, can I see raise of hands all those in favour of this amendment? Thank you. All those against? Thank you. And abstentions? Well, thank you very much. Thank you very much. Unfortunately, that amendment has fallen. That means the one recommendation is to note this budget report. Are members happy to note the report? Brilliant. Thank you very much. I now call this meeting to a close. Thank you all for coming.